My name is Anthony Fox. I'm the Executive Director of the Tennessee Mental Health Consumers Association. The Tennessee Mental Health Consumers Association is run by and for people with mental illness. We are one of the largest organizations of its kind in the nation. I spent last week in Washington, D.C. aside a delegation of mental health providers, meeting with members of Congress about threats to Medicare, Medicaid, SSI, and SSDI benefits. The news coming from D.C. is shocking and will have a devastating impact on people with mental illness unless concessions are made to protect these programs. In the last several years, Tennessee's Medicaid program has taken its share of cuts and reductions. We've reduced our costs of programming to the greatest extent possible to be able to provide quality services. We in Tennessee have done our share and feel any additional cuts will have a merciless effect on the behavioral health care needs of people with mental illness. I've had an opportunity to meet with several members of our association about the proposed cuts, and here's what they have to say.
I'm Sandra Warhurst, and I come to TMHCA. It helps me to be able to remember a little bit, and I don't have any memory at all. I really rely on my Social Security and my disability, and there's no way I would be able to work again because I can't remember from 30 minutes to the next. They say that my memory cells are no good, and it would be desperate if they did take our checks away. And we really need that to survive on. Please help us. Please help us. All I've got to rely on is my brother, because my father passed away this year, and my brother is the one helping me. But my check is what I survive. Please don't do this to us. Please. In God's name, please don't do this to us.
My name is Debbie Hunt, and I lose my TennCare and my SSI benefits, which I used to live on, and I would lose transportation to my doctor's visits. I would lose probably getting to go to all my doctors and being able to pay for my medicine, and I would probably be homeless if all the benefits were cut out.
Hi, my name is Nathaniel Season III. What do you feel like if I lost Social Security card, Medicaid, or Medicare? I would lose transportation to come to my center. I would lose my center. I would lose my health care. I would lose my insurance. I would lose everything that's responsible that would require for me to live on my own. I would lose my group home, and I would go back into my state of panic and crisis. Everything will be a crisis. Everything will happen. Everything will be back to square one. We got to keep Social Security because the people that are on disability got to have it to live. The people that are need Medicaid got to have that to live. The people that need all these different things got to have to live. We need transportation. We need money. We need things to buy things. So if we lose them, we lose our way of living. Thank you, and God bless.
Medicaid is the primary source of funding for safety net mental health services. Any reductions will have a devastating impact on people with mental illness in Tennessee. Please contact your member of Congress and let them know the seriousness of cutting Medicaid benefits. Some things that are important to know. If Congress chooses a Medicaid blended rate option, it will severely reduce federal Medicaid and CHIP payments. The option would shift costs to states and limit mental health care for Medicaid beneficiaries. Ask members of Congress not to adopt a Medicaid block grant model or any proposed spending caps that could result in spending caps and service reductions. And finally, ask Congress to oppose repeal to the Medicaid maintenance of effort, which would allow states to roll back eligibility for their Medicaid programs. Today is July 25th. What is needed is for you to act today. Contact members of Congress immediately. The Tennessee congressional map and contact numbers for Congress are as follows.